Hi, welcome to Prescribing Errors in Clinical Settings module. In this module, you will learn about the medication error, the definition of prescribing error, the incidence of prescribing error, contributing factors to prescribing error, types of errors in clinical practice, example of errors, legal implication of prescribing error, action when error occurs, and how to minimize prescribing error. Let's go through the definition of error. An error is something incorrectly done through ignorance or inadvertence or a failure to complete a planned action as intended or the use of an incorrect plan of action to achieve a given aim. What about medication error? What is the definition of medication error? Medication error is defined as failure in the treatment process that leads to or has the potential to lead to harm to the patient. Now, let's learn different types of errors. There are 4 types of errors. The first 2 are also known as mistakes. Let's take a closer look at what is the first type of error. The first type of error is known as knowledge-based error. For knowledge-based error, error occurs due to lack of knowledge. Example would be giving penicillin without having established whether the patient is allergic or not. This is considered as knowledge-based error. Now, what about the second type of error, which is rule-based error? Rule-based error can be interpreted as using a bad rule or misapplying a good rule. As an example, a doctor injecting diclofenac into lateral thigh rather than the buttock. This is an example of rule-based error. Now, let's learn the third and the fourth types of error. The third and the fourth types of errors are also called skill-based error. The third type is known as action-based error. Action-based error is also called STIPS or technical error. As an example, a pharmacist picking up a bottle containing diazepam from a pharmacy shelf when intending to take one containing diltiazem. Now, what about the fourth error? The fourth error is called memory-based error, which also known as lapse. An example would be a doctor giving penicillin knowing that your patient is allergic to it, but you forget about it. This is an example of memory-based error or the type 4 of error in medication. This is just a recap about medication steps that you have learned in introduction video. The medication steps involve prescribing, dispensing, administering, and lastly, monitoring. Errors could occur in any of these steps. Patients who are at high risk to medication errors made by the medical practitioners. Certain group of patients are at high risk or prone to medication errors made by the medical practitioners. Therefore, it is important to be aware of the drugs that are commonly associated with morbidity in general practice. Which group of patients are at high risk to medication errors made by medical practitioners? Elderly patients, particularly when frail, patients with acute medical problems, patients who are on hazardous medication, patients with renal or liver impairment, patients with multiple serious morbidity, patients with cognitive impairment, and children and neonates in pediatric settings. These are the groups of patients who are at high risk to medication errors made by medical practitioners. Medication errors can occur along the medication steps Errors could occur when choosing a medicine which is considered as irrational, inappropriate, or ineffective. Errors could occur during writing a prescription, and this is caused by poor handwriting of medical practitioners that is illegible by other healthcare workers. Medication error could also occur during manufacturing process of the drugs. This can be wrong in terms of formulation or wrong strength, contaminants or adulterants, wrong or misleading packaging. So these are considered as error in medication as well. Medication errors could also occur in dispensing the wrong formulation due to wrong label or wrong drug. Medication error could occur during the administering step. So what could happen is that errors could occur during administering, and these could be due to wrong dose, wrong route of administration, wrong frequency, and wrong duration of treatment. And lastly, errors could occur during the monitoring step. What could happen? Sometimes the prescriber failed to alter the therapy when required, or there is erroneous alteration made by the prescriber. In this module, you are also required to be familiar with the definition of side effect, adverse drug event, adverse reaction, and adverse drug reaction. So have a look at this slide and you can revise it at your own time. Make sure you understand the definition of each terminology and do not mix up. Okay students, by now you should be able to understand the steps in the medication and what errors could occur during each step. In the next video, you will learn more on prescribing errors.